All right, Kathy. One of the first things I like to do is go over potential benefits and risks to exercise when you start an exercise program. One of the first benefits would be lowering your blood pressure, which makes it easier on your heart to pump blood throughout your body. Makes that more efficient than it was before. Along with that, you would also increase your oxygen uptake, which means that your body is transporting oxygen to your muscles more efficient than before. One of the more obvious benefits would be lowering your body fat, decreasing your weight. And then with cholesterol, you would be increasing your HDLs, which are your good cholesterol. And then you would also, along with that, be lowering your bad cholesterol, which is your LDLs, which would reduce the amount of plaque in your arteries so your heart can pump blood easier than if you had plaque. And then psychological benefit would be lowering anxiety and depression. So if you're in a stressful part of your life, it's good to exercise to take your mind off of things, to reduce
Does it help
stress.
you sleep better?
Yes.
Okay.
A potential risk would be an increase in musculoskeletal injuries. This is more common for people who haven't been regularly exercising because their muscles aren't used to exerting forces. When compared to somebody who has been physically active, their muscles are more capable of exerting force than someone who hasn't been. And then along with that, there's also an increased risk for a heart attack or sudden cardiac death. This is a higher risk for people who have not been exercising and want to jump straight to vigorous exercise. But since you have been participating in regular exercise, being physically active, and since you only desire moderate intensity, this risk really isn't that high for you. So going over your pre-participation surveys, I see that you're only taking one medication, but that does not affect exercise. Your allergies are environmental. It says here that you have participated in physical activity 30 minutes a day for the last 3 days a week for the last 3 months. Is that right?
Yes. Wash my dogs.
Okay. And it seems that you don't have any signs and symptoms of cardiovascular disease. You don't have any medical conditions that affect your cardiovascular system. Is that correct?
Correct.
And based off of this information, you should not need medical clearance. And I look forward to working with you.
Okay.